Hello guys, what's up family? Hope everybody is doing well. Welcome back to another video of Life with the Fossils. Here is your girl Mpho, a mom of two, living in Germany. I come from Zimbabwe. My husband comes from Ghana and we have two children. So on this channel, for all the new subscribers, I just want to tell you guys, thank you guys for joining the family. Thank you guys for actually staying tuned in, and I see the love, I see the channel growing. Thank you so much. In this channel, what to expect: lifestyle videos, makeup videos, fashion videos, cooking videos, generally lifestyle in Germany as an African, yes, as a Zimbabwean, yes. So guys, let's get straight into the video. So one of the weeks, one of the followers actually suggested for me to do a sit-down video and actually clarify what are the roles of an anesthesia nurse. This was very interesting to me, so I thought to myself, definitely, I got my paper here ready, so I am definitely going to be reading what I wrote for you guys so that I will not forget anything. So let's start off. You come in the morning, your shift starts at 7:15. You come in, and first things first is that the doctors come at around 8 o'clock or 7:45. So you come at 7:15 so that you have time to like actually check your plan and go step by step so that you avoid anything mistake wise, because that is generally on you. So the role of an anesthesia nurse is the fact that all the machines you are checked by you and you make sure that they actually function well. So what happens is when you come into the operation floor, you take your key, that is your BTM key, and which is the medication that is always locked up. You check your operation room. Every nurse is selected to their own operation room. So, and every operation room is selected to a different department. So, for instance, in our hospital, we have the Unfallchirurgie. I'm going to mention them in Deutsch, guys. I'm so sorry, but I will make sure that I will write them down and list them so that you guys know what they are called. So, you have your Unfallchirurgie, which is like your orthopedic operation room. Then you have your visceral chirurgy, your stomach digestive, your digestive operation room. You know what they do with the stomach issues, actually with the digestive system, yeah. And then you have your gynecology room, and sometimes the gynecology room takes more than 1 or 2 operation rooms. And then you have your Hals, Nase and Ohr, that is your neck, nose and ear operation room, which means like sometimes the children can also be operated there. We have selected dates where the children are also operated. So you know that if you are in the H and O, yeah, Hals, Nase and Ohr operation room, you know that there are days where the children are going to be operated. So that's already on another different level of anesthesia procedure. So, and then we have also an ambulanter, which means the patient comes and they get operated, like small operations that don't consider the patients to actually sleep in the hospital. And then we have the outside area of the operation sector, which is like your Kreissaal, you know, your cesarean sections. We are also there. In the endoscopy, we're also there. In the Herzkatheterlabor, in the heart catheter laboratory. I'm trying to literally directly translate this word so that you guys can also understand. Correct me if I'm wrong, if that's not what they are called in English. And yes, so those are the departments that we actually go to. We actually also have the shock room, but the shock room is also is actually specifically meant for emergency sector and the intensive sector, because we would have so many sectors that we are taking over. So the intensive goes there. If they need us, they tell us that, okay, because you know the anesthesia actually specializes in the airway, the breathing, and the circulation, mostly on these three parts. So in every sector that you go, you know that you are just dealing with these three parts, which is really, really good. Okay, so let's start in the morning. You come in, I've already said, you take your key to your medication box, and you check your plan, so you know where you are already appointed to. And as you do that, you know that you look at your patients, what kind of operation are they getting, which means what is the plan of the operation, what is the plan of the anesthetic procedure that is going to be used. Okay, so yes, in the operation room you have your narcosis machine, which means your breathing machine. You have your medical cart with its medication, with the utensils that you're going to be using. Everything that you need is in the medical cart. You have your perfusions that you're going to be, sometimes you have patients that need medication through the perfusions, or if you are doing a TIVA, which is a total intravenous anestheticum, which means the medication runs through this machine without gas. Yeah, so that's why sometimes we have also the perfusions, and we also have a heating system. So you know that those things have to be functional before an operation starts, and that is your responsibility. If there is any failure when it comes to like a machine or anything, you are held accountable for that. So we go ahead. You also have like your suction machine. Your suction machine is very important, and you need to make sure that it is very functional. I'm sorry for using my hands, but I'm trying to be very like accurate. So especially when it comes to the wording of the sentences. So because the German and the English are mixed together, so I'm trying not to mix things together. Okay. Yes, so those are the machines that you have. So when you come in the morning, it is your responsibility to make sure all those machines are checked, and every machine has to be checked every 24 hours. So which means when you come in the morning, you check those machines, you check that even the cables are all in order, they're all plugged in, and also the tubes are changed. We are dealing with fresh tubes, fresh everything. When you say that that is done, you go ahead and you check if your medical cart has enough medication for the day, or at least for the first operation that is going to be taking place, so that in any state of emergency you are already ready to just grab the thing and use it. You don't have time to run outside, you don't have time to do anything. You need to make sure that your operation room has everything in the near. And then second of all, then comes in the anesthesia. The anesthesia doctor goes through with you. You discuss with your anesthesia doctor, because the whole day you are going to be working together, just the two of you. Yes, and so a lot of discussion goes in place to also for you as the anesthesia nurse to know what is the plan of every procedure that is going to be taken according to the anesthesia plan, right? So that if there are any emergencies, you are already prepared for them. You already prepare yourselves. You go through the medication just in case you forget anything, which you are not supposed to. You go through your medication with your doctor just to make sure that he's also aware of the medication that you've prepared. And yeah, exactly. Then afterwards, when you know that everything is prepared, you go and you take your doctor. You go and take your patient. When you are taking your patient, you are also allowed to actually ask, go through the protocol of information, yeah, where you ask the name of the patient, the information of the patient, so that you clarify that it is the right patient that you guys are taking. This can be asked frequently because there are different departments that the patient goes through. The patient comes into the place where, first of all, they are going to be held by the people that prepare the patient, so they are going to be asked. And when you are coming to take the patient, you are not going to what you call this, like rely on the fact that questions were already asked. No, because if you make a mistake and take the wrong patient, it is you who is accountable for that. So you can also ask the information of the patient and ask if the patient is aware of which operation is about to take place. If the patient has not drank or eaten anything for the last 6 hours. If you have time, you are allowed to also, actually you're not allowed, but it is your responsibility to also make sure that the patient has like a peripheral vein catheter, so that where you administer your medication. Any allergies, any metal in the body, those things you also ask the patient. Okay, and then you drive your patient to the operation room, and the first things first is that you, as the anesthesia nurse, sometimes the doctor actually helps out, but mostly they are also looking at the information, at the documentation, at the file paper, at the files, at the file of the patient, to see if there are any complications or anything that we have not been informed. While the doctor is checking on that, you prepare the patient in monitoring the patient. I mean, putting the patient onto the monitor. So you already have, before you start your anesthesia procedure, you already have a blood sugar measurement, you have your oxygen measurement, and you have your EKG that is already reading to see that everything is clear and everything is okay before you start administering medication. Okay, and then the other step is that when everything is cleared, with the doctor has seen that there are no complications, nothing was missed out or information that we need to know, then you start the procedure. What happens is that the doctor stands on the head of the patient because he is going to be oxygenating the patient, and you are already standing with your medication because you are the one who's going to administer the medication whilst the doctor tells you what how much doses to administer into the peripheral vein catheter. The process goes smoothly, sometimes as planned, but sometimes, as you know, life as it is, it can go not as planned. But knowing that you also are knowledgeable enough to know the process of when an emergency comes, how to react and what to react and what to do. So you have already the things prepared well. So when the doctor mentions to say we are doing this, you are already ready. Sometimes the doctor does not mention, you just need to make sure that you already have the things prepared so that you do not be running around or you put the patient in what you call this, in a difficult situation, yeah, because you want to make sure that you are doing the right thing and a safe procedure for the patient. Okay, so you administer your medication, and which means when you are preparing your medication, you need to know the work, like what the medication does to the body, the effect, the negative effect, the positive effect, and how the medication works in the body, yeah, to the organs, to the heart especially, because as an anesthesia nurse, I said you deal with 3 ways. You're dealing with the airway, you're dealing with the breathing, and you're dealing with the circulation. So those 3 important factors are very important to be very aware of them. Okay, so, and when the patient is already sleeping, the doctor is going to beatme, help the patient to breathe, either using the machine or is going to be using a hand, okay? So the patient is able to breathe, because now the patient cannot breathe by themselves, and then you help with handing out the things for the intubation. So when that is done, yeah, then you know that you're the one who is going to secure the airway, and everything else that is happening around. If it is a laparoscopic operation, you know that you have to put like your I don't know what is called a Magenzonde in English. So you actually put a Magenzonde in the patient. When it comes to the fact that the patient is not being intubated, rather is getting a larynx mask, you are the one who inserts the larynx mask. Yes, the larynx mask is the one that ends up at the Kehlkopf, so that yeah, so that it is open for air to enter. Okay, so the next part is that so whilst you know that what type of operation is happening, you guys are aware of the plans. As I said before, you speak with your patient. So sometimes when you are in the orthopedy, yeah, you know that your patients actually get a block. So you know that that is a nerve block. You prepare for the medication for the nerve block to be administered, and yes, you're the one who prepares all that. And when everything is ready, the doctor also comes, because you can do things parallel, you know, whilst he's there monitoring the patient, you can go and prepare for the other patient, so that the plan does not delay, because it starts with us. So if there are any delays, people can easily blame the anesthesia side to be like, you guys were slow, you guys did not plan this well, or so and so and so. Yeah, so guys, and when you are going to the crisol also, you know that generally as an anesthesiologist, I want to tell you that you need to be well equipped with information, what you are doing, where, in which department you're going, the effects of everything that is happening. Even when the patient is having certain diseases, you need to know like what is the effect of the medication that we're doing, or the procedure of the operation. So, and how do we help to avoid any difficulties, especially when it comes to the anesthesia procedure. Generally, that is what it is. You are working hand in hand with your anesthesia doctor. You are discussing with your anesthesia doctor what you guys are planning to do. Sometimes the plan does not need to go according to what was discussed. Of course, it has to be, but if things don't go according, like, you know, sometimes you plan things, if they don't go according to the way you guys planned, you know that your plan B is always prepared for, and you can always lean on that. So generally, you are the one that makes sure to prepare everything when it comes to safety gear, safety everything, safety procedure. You are the one. And your anesthesiologist also needs to know that things have been also prepared for, and she can also control to avoid any mistakes. Usually they say that medication needs to be observed by a fear eye concept, which means two people that are standing there to administer, to say, yes, I've seen the medication and this is the right medication that we're using. The anesthesiologist is not going to be in the pre-medication, so we are not involved in the pre-medication. What is discussed before the operation, we are not there. We actually see from the protocol to say that is what we are doing, and on that day, that is what you're discussing with your anesthesia doctor. And also know that we rotate as anesthesiologists. We do not stay in one place. You do rotate everywhere else. So the operation, the anesthesia starts at the pre-medication all the way to the recovery room. You as an anesthesiologist, you also go to the recovery room, because so that you can also know the process, the procedure. That is how it is. So sometimes you cannot be in the operation room. Sometimes you have to be in the recovery room, because they are not, maybe in some hospitals you'll find that if people are well staffed, there are people that are set to just stay in the recovery room, which is okay. But as an anesthesia nurse, you also go to the recovery room, and I feel like it's okay, because you also get to see the other part of the side with where the patient wakes up after the anesthesia, and yeah, just to help them out and to see what is the pain procedure for them and how can you help them until they are led off to the station. So yes, that is generally what an anesthesia nurse does. Please tell me in the comment section below if there are any things that I forgot that you guys can let me know. As I said, in the Vita building, you guys learn a lot. You're also taught how to intubate. You're also taught how to do like the oxygenating. Guys, English is no longer cooperating with me. But like oxygenating the patient, you're also taught on that, and not foul situations. I feel like it's a very interesting thing. It's a very interesting course, especially if you know that as a young person, energetic person, ready to learn. You can take it up, and it's a very interesting procedure, I must say. It's a very interesting part of nursing that most people don't actually talk about, but I feel like these things should also be openly talked about, so that especially like for the nursing students, this is the advice that I can tell you guys. Already know where exactly you want to go and work, because you don't want to be in a situation where you are actually forced to just be in a place where you don't want to work, because it can then be very discouraging. So find out what kind of nursing departments are there. And yes guys, let's talk about everything nursing in the comment section down below. Would you do anesthesia nursing? Is it something that you would consider? Yes, and if so, tell me please, why would you? And for all the other nurses, please let's discuss. Maybe someday we can actually make even a live video and talk about everything nursing to help each other out. Yes guys, I would love to hear your thoughts about it. Okay, before I close off the vlog or the video, I actually am going to take my phone here, because there are some questions that came up that I was not able to reply, and I would love to reply them live on the video, so that they actually get like a proper reply, because sometimes typing you might mistype things, and yeah, exactly, it's easier for me to just reply oral. Yeah, okay, so this person says, I don't know if I can say their names, but if not, please next time tell me. I'll just say it right now so that people can know. For next time I will not, if it's uncomfortable for people. So Lungani Sivanda MNP asked me, he was like, hello ma'am, in other video you said when you finished Ausbildung your other Mitschüler went straight to anesthesia, and you went after 1 year after you spoke with her. Then you said hospitals need 2 years nursing experience. Does it differ with hospitals? I think it differs with hospitals. I cannot say exactly what is the exact procedure, because even when I started after that 1 year, there was a girl who was freshly coming out from the nursing college, and she had already started with me, because either way you're still going to be taught for the first 6 months. You're being held through how to do it. So yeah, you know, I think it differs with every hospital. If you know already that anesthesia nursing is something that you'd like to do, I would actually advise you to actually apply, actually go and try your luck, try your best, apply whilst you are at your 3rd year, secure yourself a place. If they decide to take you, they will take you, and if not, then you will know okay, when exactly do they take anesthesia nurses. But in most cases, as I said, try your best, because I've had a scenario where my Mitshula went directly from school into anesthesia nursing. And as I said, even after I started that 1 year, there's a girl who came and started straight away from her school. I don't know what we were told. Whilst we were still in school, they used to say, you know, you have to have at least a 2-year experience before you can start in the anesthesia nursing. But you know, people just talk things, and it's not the hospital, unless if it's the hospital telling you that, then of course. But I think the 2-year thing, I think it's just generally because of the Weiterbildung. But in general, what I can say is, try your best, try your luck. Just send your application in school. As a nursing student, already know where you want to land. So try your luck. If they refuse, they know that they will take you a little later. If not, you know that they will also take you and help you through the procedure until you become like experienced. So yes, guys, that is my advice to that question. Okay, and then the next question was, okay, how much tough to get a specialized advanced vocational degree, which is the Weiterbildung, means how much is the per seat competition to get a seat? Actually, on this one, I feel like it differs with every hospital. Where we are at in the intensive, they say that they're taking all the intensive nurses that are not in the advanced vocational degree, yeah. But in the anesthesia, they were only like, they're only taking 1 or 2 people, depending if the place has already filled up, yeah. Which means by us, they don't take much people. But that is just our hospital. Every hospital is different. I cannot really say per se how much do they take as in the in the class, how many students, I do not know. But only I know is that for us, they only take 1 or 2 every 2 years, which I find very unfair. Because if you're already like an elderly person, or you are pursuing like to say, okay, in this point in time, I should be already holding my advanced vocational degree, I think that is very unfair. So some people, what they do is that there are agencies, and agencies are actually offering also people to actually do this vocational advanced degree, which means you can actually do it with the agencies, and you don't need to pay them back, and you don't need to stay there. So I mean, there are many ways of going about it. And then this person went ahead and said, is there any entrance test for that? There is no entrance test for that. You just need to write like your application letter, or exactly just to make sure that, you know, they know that you're interested in doing it. And yeah, exactly. What would be the main hurdle? The main hurdle, as I said, I think is just to say, you know, who are they picking first? Because, you know, also as foreigners, I feel like sometimes we need to fight our way through to make sure that we are seen, so that they know that we are also are capable of wanting to do this vocational advanced degree. That is what I can say. And the other question that this person asks is the fact of nursing shortage, is it real or just hyped, made by agency? Can you tell me the approximate vacancy of nurse in each department? I mean, the shortage of nurses is actually real. It's not like it's something that people are making up to just attract people or anything. No, it's really real, because when you see that in a shift, a person can actually do a job of 2 people than to be doing a job for 1 person, which already tells you that there's a shortage of nurses in that department, you know. So, and people are overworked, and that's what I think Germany is trying to reduce, the being overworked of people. So what I was saying is that you'll find that there are certain departments that everybody likes to go to, you know, and those departments, they actually get filled up easily. And you find that the other departments have less people working there. So I think that's the whole point. I can't really say how many nurses are taken in each department. It differs. In every sector, it differs. And yeah, just try your best. If there are places, I feel like in nursing, you need to know exactly what is it that you want. Don't just be like, oh, we will see where we'll land, you know, because you can find out that you'll be actually in a department that you do not like. And know that even if in that city, if the places are full, you can actually do apply in other cities until you find like maybe what you exactly want to do. Have options, maybe have 1 or 2 options to be like, okay, this is where I want to go, this is what I want to do, and this is what I do not want to do. Because one thing that you notice is that when you are going for interviews, they already try to manipulate you to be able to put people in places where there are a lot of shortage of nurses. So you'll find out that if you go to that place and it overwhelms you and you don't like it, you actually have like a negative mindset towards nursing. So it is a very good thing to have a plan, know what exactly is that you want to do. I think that will help. So even if in one hospital you get a negative reply, know that that is not the only hospital that is there. You can apply into a dozen of hospitals around Germany and you will definitely find what exactly you are looking for. Yes. And the next question this person asked was, what is the vacancy of special nurse, like intensive ICU nurses? What is the starting salary? I cannot say exactly what is the starting salary because every department differs. But what I can tell you is that you can go online and you type TV, also TVUD, yeah, that is the tariff of nurses, and then you will see in every department what they start with. I can tell you in my part we start with P8, yeah. The salary has been going up, so I cannot really say exactly what is the starting salary, but in every state it's different. I will write it down for you guys so that you can actually go and see. It's TV, which is P8 for Anästhesie, and I'm sure with intensive nurses. That is where they start, at P8 Stufe 2. I'll write that down and you guys can go and Google it. Which means then after your deductions of like your worth of taxes and everything, then you will know. I don't know how much exactly they deduct. It differs also according to if you have kids, if you are married, what kind of tax plan are you at, and all those kind of things, guys. It differs. When it comes to salary, it's very, very different. I cannot just say upfront to be like, okay, this is what someone earns, you know, because I'll be sharing false information. But what I can tell you is that when you are coming into anesthesia nursing, know that for me, for instance, in my hospital, I can tell you that for the first 6 months we're not allowed to do any like different shifts, because they need people to be, when you are doing an afternoon shift or an evening shift, you need to be well knowledgeable in that department. So for the starters, you did only one shift, and knowing that you do one shift, the money becomes just standardized to what it's supposed to be without any incentives. And so if money is your drive, I can tell you that anesthesia nursing could be a little bit discouraging, because you will start at minimum, which is just at your Stufe 8, also P8, okay. Your general nursing salary without any incentives, because incentives, you'll figure out that incentives do actually make a difference. I think almost like a 500 or 600 euro difference if you're working full-time, which is like, and if you're doing night shifts, a lot of night shifts, that makes a whole lot of difference. And know that in anesthesia nursing, we don't do a lot of night shifts, you know. It's only like yeah, Deans, we do night shifts, but it's only, let me say, for people that have real good experience. Okay, so yeah, if money is your drive, I think it could be a little bit hard. But if peace and enjoyment and career growth is your drive, then it's something that you could look up to. Okay, there is one more question that someone asked me, and I'm going to say this person's name. This was Erinek Hart 6450. This person was like, hi, can you recommend a book to read for starters? I applied in the position, but I have zero knowledge in being a nurse in anesthesia. Thanks a lot. Wow, congratulations to you, and I am sure you are going to enjoy it. The books that you can buy is an intensive, not for medicine, intensive anesthesia book by Stribel. This is the book. It's called Anaesthesia, Intensive Medicine, Not for Medicine, Compact Klar Praxisna by Hans Volter Stribel. This is a very, very good book, guys. It's well defined, and you know, to simplicity. It doesn't have like big words, like, you know, just simple words that everybody can understand. And also at work, I have like a pocket book. I will take a picture of it. It's like my pocket anesthesia book, which has every department of anesthesia. So in case of anything, when I'm not sure of anything, I just look at my pocket book and just look. And it's so small, it can literally fit in my, like in my scrubs, you know. So that's what I use. This book, guys, is very, very good. I bought it at Thalia, and it was like €94.99. That was like 2 years ago. So yes, guys, get yourselves this if you are looking into being in anesthesia. Let me put it there so you guys can actually have like a, yeah, that is the book. So thank you guys so much for all the questions. Please keep the questions coming. I love them, guys. It's actually putting me out of my comfort box, because I don't like to do sit down videos, because I feel like my language is not perfect enough to like speak. You know, I put a lot of and this and that to try and think about what I want to say. But thank you so much, guys, for the questions. Please do keep them coming, and I'll be doing a lot of videos about anesthesia nursing, so that we all can have an opportunity in this beautiful department and explore it together. Thank you for everything. I'll see you in my next video. Bye.